We wanted to make an entrance, so when a patient comes in, after they've finished all their treatment and they come in for their 3-month or 6-month or 6-year scan, we wanted them to come into an area that they didn't have to walk through the area of where they were treated at. We try to think of every different level of emotion of where the patients are and what's going on, so it's a place that we can make it better for them to come in.
Mission Hope is our project to have a all under one roof facility basically for all of our cancer patients. This area that we're looking at right now is what we call our secret garden, so it's an area that people can come to either just relax or wait for maybe their spouse who are coming in to get radiation therapy, which they would go in right through that door there. This is our newest linear accelerator. Basically, it's called a True Beam. It's really state-of-the-art, one of the few that we have in California. Actually, we're the 5th, I believe, in California. First one outside of a teaching hospital. And this is where people will get their radiation therapy on a daily basis. What we have here this is our CT PET scanner, and this is our CT scanner. So a CT PET scanner is something that we use frequently in patients with cancer to help us determine how they're responding to treatment or initially making their diagnosis. And the CT scanner is a little bit of a different GE scanner. It helps us treat breast cancer patients in particular. So each one of our research patients ends up getting a binder like this, or sometimes even 2 binders like this. And these need to be kept on site. Depending on the different protocol, they need to be kept on site anywhere from 2 years to 15 years on site. And so that's why we require this kind of a space to keep all those patients that are on active trials, and even once they're done with the clinical trial, we need to keep all their data here because they're going to be followed, and eventually that paper is going to be written to determine whether or not that treatment's a success or move on to FDA funding or FDA approval for the drug. Chemotherapy suite, this is where the patients come in and get chemotherapy, so we're on the 3rd floor of the building. The nice part about this is that we've tried to create kind of an open atmosphere with the clouds and just the great views, lots of windows around, so patients can be here anywhere from an hour to 6 or 8 hours. So we want to try to make it a reasonable work area for the nurses, but also a place that the patients can relax a little bit and not feel like it's a complete hospital setting, so to speak, for all that period of time. Eventually we're going to have some technology set up for them where they can use an iPad in here, which we're going to give out, and they can watch things on TV, they can read a book, they can read a newspaper on the iPad, or just use it for whatever they want to pass the time if they're here for a long time.